Good evening, everyone. Thank you guys for joining us this evening. It is the last Monday of the month, so you guys know what that means. It is the Ask Mary and Pat show. This is our August edition. We're thrilled to have you with us tonight, whether you're tuning in live or you'll be catching the replay later. Thanks for being here. I am Duke, the Technology and Metrics Director for Oak Hill Regional Community Development Corporation, which is the parent corporation of Healthy Kids Mississippi. And before I get started, let me remove this cover so you guys can see me. All right. So before we dive into this great show, we want to give a special shout out to our board chair, Jennifer Garrett, our executive director, Dr. Michael Miner, and our project director, Mrs. Lottie Miner. And we couldn't do this without them. And guess what? We're not just live on Zoom this evening. We're also streaming tonight's show on both the Oak Hill Regional CDC and Hill the Kids Facebook pages and the YouTube pages. And we're also streaming live on our Oak Hill Regional CDC app, which is available in the App Store free of charge. All you have to do is search Oak Hill Regional CDC or Mississippi Healthcare Help, and you will be able to download that app for again, which is free of charge. So just take a brief moment to download that app right now as I'm finishing up my opening monologue. Um, our upcoming events. Our Let's Talk About Real Estate with Area Mays will be Thursday, September 18th at 11 a.m. And our next third Wednesday parent resource chat will be Wednesday, September 17th at 11 a.m. We will drop the links to those webinars in the chat. Since we are still in the month of August, we had two health observances that we that we observed, which was National Immunization Awareness Month and National Breastfeeding Month. For September, we have National Childhood Obesity Awareness Month, Sickle Cell Disease Awareness Month, National HIV, AIDS, and Aging Awareness Day, which is September 8th. We also have the National Baptist USA Hope Senior Recognition Day, Recognition Sunday, which is September 14th, and as well as the Sickle Sabbath Sunday, which is September 21st. And at the end of these, we remind at the end of this webinar, we will remind you guys again about these announcements. Once again, we encourage everyone to ask any questions that you may have. Share this webinar with people that's in your network. We will make sure we are able to answer those questions, and if we were not able to answer them live, we have our Medicaid application administrators who will get back with you in a timely manner. And now I have taken up enough of your time, so I'm going to turn it over to the hosts for this evening, Miss Mary Fenner and Miss Pat Boga. Ladies, it's in your hands.
Good evening, everyone. My name is Mary Fenner, and I'm a Medicaid application administrator and a navigator for Oak Hill Regional Community Development Corporation.
Good evening. This is Ms. Pat Boga, and I am also a Medicaid Applications Administrator and Navigator with Oak Hill Regional CDC, and we're just honored to be here tonight.
Okay.
We already have a list of questions.
Okay, you can go ahead, Pat.
Want me to go ahead and start?
Yes.
Okay. All right. Well, our very first question we have is my children started back to elementary school last week. I want to make sure their vaccines are up to date. Will their Medicaid pay for them if I take them to the doctor? Okay, and the answer to that question is yes, Medicaid should pay for them. You should contact their healthcare provider to see what vaccines are needed and have them check your children's Medicaid to be sure. And you can also call the Medicaid office or visit medicaid.ms.gov to verify this as well. And you definitely want to make sure the kids are up to date on the vaccines because the vaccines help if they are vulnerable or susceptible to various infections. And they are back in school and around a lot of children And this is opposed to, being at home with family. So now they're around a whole lot of children and people. So they need those vaccines.
Yeah, that's true, because when you get around children or people, period, that you haven't been around in a while, you don't know what things they have going on or who they have been around. So it's good to get
Right.
those vaccines. That's necessary to keep your children healthy. Okay, our next question is, my child is also going back to school. I am not sure if her Medicaid is active because I haven't received a renewal letter yet from Medicaid this year. He hasn't had to go to the doctor so this summer. How do I find out if her Medicaid is active? Well, what you want to do, what you need to do is contact your Medicaid office to see if it is active. You can call or go by their office to check. Also, be sure to update your contact information if you haven't done so with Medicaid. If you have moved or your last renewal, if you have moved since your last renewal or changed your phone number or email address, your renewal may have gone to your old address and therefore your child may not have Medicaid. But also Medicaid has on their website, they also have a way that you can create an account and look up your Medicaid information. If that's something that you are familiar with working with computers, you can do that as well, and that will let you know if your child is on Medicaid or not. You can always contact our office and we can try to assist you. We can check and see from some of the resources that we have to see if check and see if your child is on Medicaid. And our number is 662-298-3584. And you can ask to speak to one of the Medicaid application administrator.
Okay. Okay, we have another question. My 19-year-old son's Medicaid just recently ended because he turned 19 last month. He is attending college this fall and really needs health insurance of some sort. What options do we have now with him getting health insurance or help with medical expenses if he has to go to the doctor or purchase medications? Okay. And some of you may already know that Mississippi has not expanded Medicaid, so he won't be eligible for Medicaid now unless he has a declared disability. You could also apply for the Affordable Health Care Insurance at the Affordable Care Act's Affordable Health Care Insurance to see if he qualifies and get him enrolled. You would actually have to meet the income requirements and also the family size as well. Okay, now if it's just you and your son, of course, that's just two, but I'm not sure if you have any more family members, but it will be based on the family size. And again, you have to report the income. And if you're getting insurance for this child, you will have to be the one claiming him on your taxes. And you may also want to consider taking him to one of the federally qualified community health centers in your area. And they have a sliding fee scale. And actually, what this does is it will help lower the cost of doctor's visits and also medications. And you may also possibly be eligible again for the Affordable Care Act's health insurance. If you would like to look at plans and prices to see if they are suitable for your son or your family, again, we have navigators here at Oak Hill and we can help you. And again, that number is 662-298-3584. We can assist you.
Okay, we have another question. What do I need to do to get my children approved for Mississippi Medicaid? I just moved to Mississippi from Texas, and I need to get them on Medicaid as quickly as possible because they can't start school without some form of health insurance and have it on file in the school. Well, our agency, Oak Hill Regional Community Development Corporation, can assist you with applying for Medicaid. You can give us a call at 662-298-3584 and ask for an application administrator. The application will be completed over the phone with you and submitted online with your consent. You will have to give verbal, or written consent for us to complete the application with you. We can also meet you at a location in case you don't want to complete it over the phone, either in person or over the phone and online. We will submit the application for you online. After the application is complete, you will have to submit income verification or how your expenses are being paid if you're not working. Another thing you will have to do is make sure that your Medicaid from Texas has been canceled. You can't have Medicaid is not transferred. When you move to a new state, you have to apply for Medicaid in that state. You have to cancel the Medicaid in your previous state, the state that you're moving from. So that is one of the first things that you need to do. If you know you're going to be here for a while, or this is your place, going to be your place of residence, then you need to contact your Medicaid people in Texas and get your Medicaid canceled. Let them know that you have moved to Mississippi. You're going to have to show proof that the Medicaid has been canceled with a letter or a denial letter or a closure letter, however they do it in Texas, and submit that along with your application. But once we put the application in for you, they give you time to submit any required information. So we can put the application in for you. They'll send you a letter letting you know what's required. If you need to do a denial letter from your previous Medicaid, or you need to submit income verifications, all of that, they will give you a couple of weeks to get all the information into them. And if you need more time, you need to let them know that you're trying and I haven't been able to receive the information that I need, showing that my Medicaid has been canceled. But just contact them once the application has been submitted. Once you receive the letter stating that what is needed for you to complete your Medicaid application, but please, please, please get your information in on time, because if
Right.
it's not, they will close the case. Because they have a time limit as well, is when they have to process the case. And so they have to have, the case has to be processed by a certain time by them. So that's why they give out time limits. So please, once you get your letter, look into it, see what you need to submit, and submit the information.
And we've also had some to say, they didn't give me enough time, but, they initially, and even when we're helping consumers, we let you know up front that is normally 30-day processing period. So, they'll let you know ahead of time, and just work as quickly as you possibly can and try to get that information in.
And if you're having a problem getting the information, contact them and let them know
Right.
that you're still trying to get the information that's required, or whatever issues that you may have, because sometimes they may be able to help you get a denial letter from whatever state that you're moving from. You just need to communicate with them and let them know what's going on.
Okay. Let me see. I think it was one question before that. My child is having some mental health issues right now since he was held back a grade this past school year. He has started back to school now and experienced some issues, I think, with bullying because of this. She does have Mississippi Medicaid, will Medicaid pay for mental health services? And we're sorry to hear that is taking place, but definitely Medicaid does cover mental health services. And but I think it would be best for you to talk to your child's primary care physician to make sure a referral, to make sure you get a referral, and that the provider can check to see which doctor or facilities accept Mississippi Medicaid. And again, so sorry that your child is experiencing the bullying.
Okay. How can I find a doctor or dentist that would accept my child's Medicaid? You can search the database. There's a Medicaid database that has doctors or dentists that's available that would accept your Medicaid. You know, all places do not accept Medicaid, but you can check, or you can call yourself and see if that particular doctor or dentist would accept Mississippi Medicaid. That's the best thing to do. Call a doctor's office, let them know you have Mississippi Medicaid, and see if they take it. Then there you go from there to make your appointment. If they don't take it, then you need to call and check someplace else that will, or either call. Medicaid does have an 800 number that you can call, and they can research and find a doctor or dentist in your area as well. And Pat, do you know that number?
Okay, I believe it's 1-800-421-2408.
Okay.
And
And
I'll
you
make
can,
sure that I clarify before we leave.
okay, yeah. But yeah, you can check with them. They also do a research. They have a provider research. You can go online through Medicaid, www.medicaid.ms.com, and you can go on there and check with them. And they have a search that you can do as well to search for a provider. You can go on there to search for a provider. So there's several ways that you can find a doctor or a dentist, or if you know someone else that's on Medicaid and they can let you know, well, yeah, this doctor take it or this dentist takes it. You know, there's several ways that you can uh, find a doctor or dentist in your area that would take your Medicaid. So,
Okay, I'm so sorry. It says that my internet is not stable, so, but I'm back. And
I can't hear you, Pat.
yes, it's saying that my internet is unstable, so,
Oh, okay, okay.
but I'm back. I was also trying to find that contact number, and I believe that was the correct number, though, for the Jackson Medicaid.
It sounds like it.
Okay.
Do you want me to take the next question or?
Yes.
Okay. The next question that we have is, can I transfer my child's Medicaid from Georgia without applying in Mississippi? And unfortunately, you cannot. Each state runs their own Medicaid program. It's federally funded, but it's state ran. So each state has their own Medicaid program. So once you leave Georgia, you need, and you know that you're going to be a permanent Mississippi resident, you have to apply for, and if you want Medicaid, you have to apply for Medicaid in Mississippi. Let Georgia know that you're no longer living there so they can terminate your Medicaid in Georgia. And you have to let them know in order for your Medicaid to get on here, because you can't have Medicaid in both states. You have to let them know that, and we don't want you to get any type of trouble trying to have Medicaid in two states.
Right.
So you must terminate your Medicaid in Georgia and apply for Medicaid here in Mississippi.
Okay. Now, there's another question. It says, how can I find a doctor or dentist that will accept my child's Medicaid?
And that's the one I just did.
Okay, you went over that. I missed that one. So,
Do you have those other questions?
okay, let me see if I can find those. Okay. I have applied for Medicaid for my children, but was denied because of being over the income limit. My income has changed and I am making less money. How long do I have to wait before I can apply again? Well, actually, there's not a waiting period. You can reapply anytime you like with your new income verifications. Now, for instance, if you applied in August and they used July income and you were just recently denied, you would probably need to wait until the first part of September to reapply, and then they'll use August income. But actually, you can just apply anytime that you like, as many times you like as well.
Yeah, and you can let them know if you reapply in this at the same time or month that you got denied, you can let them know that your income has changed. And they will require you to submit your new income, either check stubs or verification from your job, letting them know that you're no longer receiving that particular
right.
income. Just let them know that your income has changed and they you can proceed from there to reapply for Medicaid for your child.
Right, because as she said, it could be that, you're not working at all now. So just go ahead and apply as soon as possible.
Right, yes. And if you're not working at all, then you need to have a termination letter from your job stating that you no longer are employed there in the date that you were
Right.
terminated. And go from there. You have to let your worker know. You have to communicate with your worker and let them know what's going on. To let them know so that you can get the Medicaid you need for your child.
That's true. That's true, because school has started back, as we know, and we're already receiving reports of children being sick, and they've only been in school what, maybe a week or almost 2 weeks. And it's very important to go ahead and make sure. And then if you don't qualify for Medicaid, just look into something else. We've offered the option of Affordable Care Act's affordable health care insurance. You can look into that to see if you qualify. And again, we spoke of the federally qualified community health centers in your area. And they also help with medications, right? I think they can assist you.
They can assist you with the application you need to put in to get medication if you can't afford it. It's a lot of there are some companies that will give you medication at a discount price or zero.
Right,
It just depends on which one you contact. There's forms that you have to fill out, but they can assist you with filling out those forms. We can assist you as well with filling out
right.
those forms to see if you're eligible to get a discount on your medication. We also have a social worker that's with our team, and she does a lot with the federally qualified health centers, and we can refer you to her, and
Right.
she will be able to help you with your medication, also help you to find a federally qualified center within your area that you can attend.
And she can work with you in reference to checking with the different pharmaceutical companies, according to your medicines, your prescriptions, to see if they can assist you with discounts. So there are ways, don't give up. Don't give up.
Yeah, don't give up. Just keep trying. If one way don't work, you never know, another way might work.
That's right. That's
Yeah.
right.
So I have a question. I just found out that I was pregnant. I went to the doctor and the doctor told me I have Medicaid, but the doctor told me I need to apply for pregnancy Medicaid. And I don't understand why. Well, with pregnancy Medicaid, the one most important thing is that you wouldn't have to worry about getting renewed if you are still pregnant during the time that you get, when it's time for your renewal. If you apply for pregnancy Medicaid, your child would probably get renewed, but you wouldn't have to because you're on pregnancy Medicaid. Because once you get approved for pregnancy Medicaid, you get it for a whole entire year. Once your child is born, they're automatically put on Medicaid. So if you don't have pregnancy Medicaid and you have regular Medicaid, your child is born, you will have to apply to put your child on Medicaid. But if you have pregnancy Medicaid, once the hospital know, they will submit the information to Medicaid, letting them know that you are on Medicaid and that your child was just born. Your child will be automatically added to your Medicaid case. And then you will get your postpartum, and you will be on for more than just the time. It was one time it was only 2 months, but they have extended it. Now it's extended. So that's why it's
12 months.
important to apply for pregnancy Medicaid, even though you may have had regular Medicaid. So
Pregnancy Medicaid will probably cover more of your pregnancy-related, visits and
Because with-
services.
right, with regular Medicaid, you only allow so many visits
That's right.
a
That's
year.
right.
But with pregnancy
right.
Medicaid, you get more visits. So that's the one thing that you would need to apply for pregnancy Medicaid for.
Okay, we have a question, and it's how often do I have to renew my Medicaid? Well, that is normally 1 year. You have up to a year. They will contact you. They'll send a letter out to you, or they may even call you or send an email. So just be on the lookout at each one of those outlets, because again, they could call you, they could send a letter, and then they could send an email, for you to renew. And I know some have said that they had to renew within 8 months, but it's normally 1 year. You have to renew every year.
Yeah, they send a letter out a couple of months prior to when your Medicaid will end. And that's why maybe they think it's been 8 months, but they give you time. They don't want you to go have a point where you don't have Medicaid at all. So
Right.
that's why they send the letters out early, giving you time to submit the information. It may not get approved till it's time for your Medicaid to normally start, but they will have all the information that they have when they get ready to work your case, so you won't have a lapse in your Medicaid. So once you
Right.
get the letter, submit the information that they request.
Right.
Sometimes you may not have to submit anything. It might be just signing the letter and letting them know that nothing has changed. They'll let you know if you have to submit additional information, or they'll let you know we already have the information that we need. All you need to do is sign this renewal application form and send it back to us, and make sure you send it back in a timely manner, so that so there won't be a lapse in your or your child's Medicaid.
Right. And we often hear as well, I didn't get a letter. More than likely, they did send a letter out. So we just want to encourage you to check your mail. And if you get a packet from the Division of Medicaid, open it up, okay? Open it up and read it. And because there may be something that they're just sending a letter to get you to just submit without having to come in for an appointment. So just make sure that you do that. And then also if you decide to move, or if you've moved, or even if you've changed your phone number or email address, make sure that you call the Medicaid office and let them know, okay? And that way you won't risk, not receiving a letter and doing your renewal.
Right, that's important. That is really important because if you miss that letter, if they sent the letter to an old address, the letter goes back to, they do not forward it to your new address,
Right.
even though you may have a forwarding address set up with the post office, they do not forward it. The letter
No.
goes back to Medicaid and they will terminate your Medicaid because they
Terminate your
haven't heard from
Medicaid.
you. So that's why it is so important when you get that letter, or keep up with your renewal date so you know
Right.
when you haven't received the letter. So you can contact them or you can contact us and see, well, I haven't heard from Medicaid in a while. Is there any way that you can check? I've been trying to call my caseworker. I haven't been able to get in touch with them. So is there any way that you can check and see when my Medicaid is due? And we have resources that we can check and see when your Medicaid is due. So just
That's right.
don't assume, just don't sit around and say, well, I never got a letter. And it feels like
Right.
it's been a year, so yeah,
Check on it.
get on it right away, especially if you have moved. That's the
Mhm.
most important thing, especially if you have moved, or if letters do get lost in the mail as well. But
It's
just
true.
make sure that you check all your mail. Make sure
Yes.
you open your mail because
Right.
some people say, "Oh, this is just from Medicaid," and throw it to the
Right.
side. But if it's from Medicaid, please open it and
Open it.
then to see what's going on with your or your child's Medicaid.
Right. And we can help you with that too. Some
We can.
people, have trouble, they don't really understand because sometimes it's more than just one sheet, you know. So just reach out to us and we can help you with that.
Right. Okay, I see another question. My child is in need of braces. Does Medicaid cover the cost of braces? Regular Medicaid does cover the cost of braces, but if you're in a certain income bracket that's higher than regular Medicaid and your child is put on the CHIP program, with Children's Health Insurance Program, you CHIP does not pay for braces, but more than likely it's more people that are on regular Medicaid than the CHIP program, but you can always check and see. But the letter will let you know that your child has been approved for CHIP, or my child has been approved for Medicaid. So whenever you get your approval letter, it'll have on there what category your child is in, and check, and therefore if it's on regular Medicaid, then you should be able to check with your dentist and see if you can get braces. Did you see
There's a
the question
question.
in the question in
Yes,
the
in the chat. Okay. Should the person go to the Medicaid office and let them know in person that they have moved? No, you don't have to do that. You can make that call. Just give them a call and let them know. And then if you're having trouble, reaching someone there, then you may have to make the trip to the office, but just give them a call and let them know. And they can put it in the system.
back?
Welcome. Okay, and we have, I don't want to put her on the spot, but we have another one of our sisters and navigators, well, actually one of our application administrators, and that is Miss May Stigler. She is joining us this evening, and we just want to check and see if she has anything to share that we may have missed on any of the questions. Or maybe she just wants to introduce herself.
Good afternoon. This is May Stigler.
On the way to my parents' house and sleep when we got there. But then
Okay,
Go ahead, May.
go ahead.
I just wanted to encourage all the individuals that have Medicaid to make sure that they let the Medicaid office know if they have moved, or even if they hadn't moved and they just want to check and make sure that the Medicaid office have the correct address. You can always check with the Medicaid office and let them know if you have moved or if you have not moved, and make sure they have the correct address. That's so important that they have the correct address for each individual.
Yes.
Thank you.
We thank you.
Are there any more questions?
We have some of our other team members that have joined us. Do you all have any questions? Yeah, I don't see any other questions in the chat. But again, we just want to let you know that we're available to assist you. And as we said earlier, we're applications administrators with Oak Hill Regional Community Development Corporation. And there is no charge for the services that we offer. So don't let that be an issue when you want to give us a call and ask us to help you complete an application, okay? Because we are here to help you, and we want you to feel free and feel comfortable and be able to, well, know that you can trust us. We actually, before we complete a Medicaid application, we get your consent. You have to consent that we complete the application with you and get your personal information. So, like I said, we are available for you. And that number again is 662-298-3584. And just ask for Medicaid Applications Administrator. And then if you're interested in applying for the Affordable Health Care Insurance, ask for a navigator, okay?
If we don't have any more questions or any other of our team members wish to unmute and say something, or if not, I think that would be it for us tonight. We'd like to thank each and every one of you for tuning in, or even if you're looking at this at a later time, we thank you so very much. We hope that this has been helpful to you, that you may have gotten something from it. You can always submit questions at the website and we will be able to answer them at a later time. You may learn more about us at www.oakhillregionalcdc.com and this thing has to do with something. Hold on. Oh. And www.healthykidsmississippi.org. You can contact our office at 662-298-3584 or text us at 662-689-9712. As we conclude this wonderful webinar, let's take a moment to express our gratitude to those who made it possible. A heartfelt thank you to our board chair, Ms. Jennifer Garrett, our executive director, Dr. Michael O'Miner, and our project director, Mrs. Lottie minor. This has been a proud production of Oak Hill Regional Community Development Corporation, where we are dedicated to belonging, building, and bridging in the Mid-South region. Also, we have another webinar with Let's Talk Real Estate with Area Mays, which will be Thursday, September the 18th at 11 o'clock a.m. And you can always check our website or our page will let you know. Also, there's the next, well, we have third Wednesday Parents Resource Chat, which our next one is Wednesday, September the 17th at 11 a.m. 11 a.m. And our next Ask Mary and Pat show is September 29th, 6 o'clock p.m. Thank you all for joining us and enjoy the rest of your night.